So I'm Dr. Imran Ratanshi. I'm a plastic and reconstructive surgeon here at Surrey Memorial and Jim Pattison. And part of my practice is specialized in microsurgery and reconstruction and craniofacial reconstruction. When most people think of a plastic surgeon, they associate plastic surgery with cosmetic surgery, but a very big part of plastic surgery is reconstructing wounds, especially those wounds that are beyond the scope of other surgical services. Part of what I do as a microsurgery is to use a very specialized skill set that allows us to move large quantities of tissue to fill bigger defects and more complicated defects. In order to do that, we have to sew together blood vessels to keep those units of tissue alive, and that includes an artery and a vein. And we do that by hand under the microscope, and that's why we call it microsurgery. Breast cancer treatment and cancer treatment in general at Surrey Memorial and at Jim Pattison Outpatient Center has really come a long way over the past decade or two. We have robust screening programs to identify patients who are at risk for cancer or who have active cancer. Those patients can get treatment in a timely fashion with surgery or radiation or chemotherapy if needed. And part of that treatment often includes sampling lymph nodes to stage their cancer or remove lymph nodes to help reduce their cancer burden. And when they do that, patients are at risk for developing lymphedema. Lymphedema results when fluid accumulates in the limb because lymphatic channels that drain some of the extra fluid in the limb are now interrupted. When that happens, patients can be at risk for significant functional limitations. They may need lifelong compression. They can be at risk for life-threatening infections. And this program to reconstruct patients who are at risk, very high risk for lymphedema, or who may already have early-stage lymphedema, is the next evolution in cancer treatment. It's only offered currently at a few world-class centers around the world, and we're in a great position to be one of those centers with the next stage of investment. Donor support is an incredibly important part of my practice, in particular my partner's practice, in terms of all the plastic surgeons that we have here at Surrey Memorial and Jim Pattison, because it gives us the equipment necessary to provide highly specialized care to our patients.